So we are now ready to go into our open Q&A. I'll take a few questions at a time. Please introduce yourselves and your affiliation, and then we'll field the questions, and then go down the line with the panelists to begin answering, and the interaction hopefully will start. So please.
My name is Ramesh Singh. Right now I'm working at Chapman University since 2007. Before that, I was working at the Indian Institute of Technology, Kanpur. And Kanpur is located in the central part of Indo-Ganges Basin. And when we are talking about the pollution, the planetary health, I'm really very happy and congratulate to the organizer for organizing this. And what we knew from before about the atmospheric pollution since long time, since the 3 decades. And I realized in Kanpur, whenever I was going in the downtown, during winter time, I cannot see even the visibility up to 2 meters. Okay. And then I wanted to attract the attention of the government. I put aeronaut stations in Kanpur at IIT Kanpur campus. And I'm very happy that since 2001, the aeronaut station is working and people are using data from them. We never bothered that it also affects the health. Of course, the land, ocean, water has a boundary, but the atmosphere has no boundary. And also I'm happy that the Indian pollution does not affect the other countries except Bangladesh.
I'm sorry to interrupt. Could you move to your question, please?
But
Thank you.
In China, it is affecting even the U.S. West Coast. So the question is, not many, most of the population, they know about that the pollution affects the health. So the UNDP and the World Health, we should develop a program so that we can educate people that it affects the health. And in India, of course, we always talk about, we compare with the Chinese pollution and Indian pollution. And in India, if you compare with the northern part and the southern part is the highly polluted because of the geographical conditions.
So is your question about education on pollution? Could you
Beg your pardon?
Could you pose
okay.
a clear question, please? Thank you.
I would like that the funding agency should develop a program where we can educate the mass media about the adverse impact on the health. Thank you.
Thank you. Next questioner, please. Please, go ahead.
Yes, I'm Peter Small from Stony Brook University. Indicators and metrics have powerful influence over organizational behavior, and I'm just wondering if each of you could kind of succinctly state what are the indicators, the combined indicators that your organization uses to guide your activities. I'm just reminded of global health, where DALYs really help to bring things into focus. And what are the metrics that you use that integrate human and ecosystem health?
Thank you for the question. Next questioner, please.
My name is Marcel Dieke, Wageningen University in the Netherlands. I'd like to ask a question to both Timothy and Natalia. I was triggered by the statement by Timothy on should we fund projects in developing countries and help them, make them help solving problems that they did not cause. And I think there's a lot of things that we can learn from developing countries and should support the developing countries in finding solutions that we can learn a lot from. And in that sense, I was very impressed by a project that the World Bank runs in Kenya now on finding alternatives for livestock production, where, well, food security is, according to Nature this week, a meaty issue, where meat is the main problem in food security problems. In Kenya, the World Bank supports a project in finding solutions in finding much more sustainable animal protein production in terms of insect production for food, something that in many Western countries we still need to educate people a lot about. I find it my responsibility to work on that in the Western countries. It's really encouraging to see that in Kenya there's people that try to set up a project to work on that in Kenya. Well, that would be an ideal solution, and so that's also what the World Bank supports. And I think that's a good example of where we should go in terms of equity, and that connects to what Natalia says. Equity is not only, I think, closing the gaps, but also not only from Western countries help support people in developing countries, but also see how we can learn from them instead of only exporting our way of building a society, and so enhancing problems rather than learning from them to solve our own problems.
Thank you for your comment. Please, next question.
Hi, I'm Kate Dodson. I lead the global health work at the United Nations Foundation, and I've heard a lot about solutions, and I've heard the word solution a lot this morning, but I think Natalia was the first who talked about co-benefits. We've talked a lot about reducing the silos among our sectors and the different kind of line ministries or funding agencies who work on these different issues. But wondering if any of you could give concrete examples of how a co-benefits approach has helped to break down silos, and especially with regards to where the UN really has a comparative advantage in thinking about scaling those solutions through the kind of normative technical guidance and or funding that might kind of help with that scaling process.
Thank you for the question. One more question, please.
I'm Nagash Taklu from Ethiopia, from Population Health Environment Ethiopia Consortium. I am happy with the understanding from our UN World Bank report. But the issue we are discussing starting the morning, the magnitude of the problem that our planet is facing and the solutions you suggest, do they balance? Do they address the context we are in? Taking as an example the pollution issue raised. So from that perspective, what do we expect from four of you in a way that brings paradigm shift in addressing the linkage? We know our educational background is sectoral based. Our line ministries are sectoral based. Our UN institutions are sectoral based. Unless we bring a genuine paradigm shift that really address the linkage, I don't think will solve the problem. So what do we expect from four of you? One out of the box that can bring breakthrough.
Thank you for your question.
Okay, I'm a UN civil servant, so I won't comment on the picking between the US and France that you did twice today. But then there is coffee next. On the various questions, which were really very interesting, in terms of raising awareness on air pollution, well, first of all, I'd like to say that I slightly disagree with you that the Indian air pollution is not transboundary by nature, because I think India is suffering from transboundary pollution, and also, the fact that I think there is a transboundary element in the Indian pollution as well, not only for Bangladesh. We are partnering with the World Health Organization and the Climate and Clean Air Coalition under a big awareness-raising campaign, which is called Breathe Life. And with that campaign, the idea is that countries and cities are joining, and we are helping them developing some awareness-raising material for various constituencies, including schools. So there are various projects which are starting to develop some material for universities, for secondary schools, and there are efforts already ongoing. So I think there is the fact, and we've heard this morning on Planetary Health Alliance, that education is a key part. I mean, this really we are taking on board. On the fact that we may not have yet all the solutions to tackle pollution, environment, and health, I think, yes, we can reasonably say that we are not there yet, far from be. There are a number of initiatives and progress being made, which makes me think that member states may have understood the challenge. I mean, I think the Paris Agreement was already, a very big step towards recognizing that the challenge is huge and that there is a need to change scale. I think as well that the Montreal Protocol, which I mentioned earlier, has really made a significant difference at the world level. I would also mention that the Sustainable Development Goals that you may not have looked into in details was, and I'm talking personally, unhoped. The idea that member states were going to agree on such ambitious goals, such integrated goals, frankly speaking, 1 week before the summit, I wouldn't have even hoped that they would actually say yes. So I think there is a change of perception of what the scale of change is required. Which brings me to the indicators. We have obviously an indicator framework in UN Environment. Now we tend to align our indicator framework to the Sustainable Development Goals in terms of air pollution, chemicals, and freshwater pollution. We also have an indicator framework for each topic, which looks at policy and how much we are able to support policy change in countries. So it's a very tricky indicator to monitor, but how many countries have we been able to support on a given topic to take on board new science is something that we are also monitoring. I will stop here and leave the floor to Joy. Thanks.
Thank you. So those are hard answers to follow, actually. But I'll also start in thinking about how we're comprehensively addressing air quality issues at the local level. And in fact, one of the things that Fanny and I are collaborating on, along with our colleagues at WHO and UN Environment, is creating under this climate, environment, and health coalition, sorry, it's a mouthful, is a core package of 10 key interventions that need to happen at the country level. That we're in the process of discussing what they should be, but they really need to be broadly encompassing. How do you get to the community outreach as well as the policy mechanisms and the appropriate monitoring systems in place so that communities themselves can be using those local indicators of air quality themselves to do their local advocacy and talk to their local policymakers and make local change? Because it's great to collect all of this data and put it into the global research and science and these big monitoring systems, but empowering the local communities with their own information and data is really, really essential to make the change that we want to see happen. So secondly, on capturing local indigenous knowledge and the voices of communities, I think a lot of the technical tools that WHO uses, from health in all policies to health impact assessments to climate and health vulnerability assessments, are sometimes intentionally vague and open to allow local communities to identify their own issues and their own solution pathways. So in fact, I've seen a lot of indigenous knowledge assessments that I frankly didn't expect in some climate impact assessments coming back, because that was the pathway that local teams chose would be appropriate for solving their local problems. So I think that there are opportunities to bring that voice in that may not be exploited as much as it could and should be. On the issue of indicators, obviously WHO does a tremendous amount of indicator work, but often focusing heavily on measuring the impacts. And I think that there is an opportunity to look at more integrated indicators around processes and performance of some of the interventions that we're using that might be more helpful in thinking more holistically and systemically about addressing these environmental drivers. Around co-benefits, obviously this has been a major platform of WHO in their air pollution work, showing how alternative household fuel options can both reduce particulate exposure and drive down respiratory infections. And we've been building programs and advocacy on the back of demonstrating how those real intervention co-benefits work in practice and can be viable solutions. And I think, as Fanny has also said, the SDGs are really going to be a tremendous catalyst for the multilateral system as well as governments in breaking down these silos. It is intended as a philosophy to force us to think across silos. I was in a meeting just before coming here where they're planning what they call nexus interventions across energy, agriculture, water, bridging programmatic areas within UN across the agencies. It's really going to force us to work in a different way that I'm also hopeful about, because we have been naturally set up to work in silos.
Thank you, and I'm going to try and keep it short, addressing only a few of the questions. In terms of indicators, as colleagues have said, the Sustainable Development Goals, they have indicators that go with them, and more we're going to try and align with those. But for UNDP, the Human Development Index is kind of what differentiates us from saying that, we don't only look at GDP per capita, that development is about health, education. I mean, it's a simplified, but the Human Development Index captures health, education, and GDP per capita together to say this is what development looks like. And I think in 2012 we had a report on environment. The Human Development Report is an annual report. It was on environmental sustainability. And they pointed out which countries, for example, Costa Rica, are doing well on the Human Development Index, but not sort of having a huge environmental footprint. So I think highlighting some good examples that you can have countries do well without the environmental impact has been really useful, and it kind of goes to your question about what can we learn from the South. I mean, there is that hope that countries that have done well in that regard can teach something to the North. For UNDP, a way of working is kind of South-South cooperation as a modality. We host the UN's South-South Cooperation Office. The idea that we can learn across countries of the South, triangular cooperation with North, kind of bringing in resources and technological advantage. I think from an equity perspective, we do need to always make it clear that countries in the global South were not responsible for a lot of the environmental degradation that we've seen in our planet. So there is a responsibility of the North to help out, whether it's through finances, technological advances. But of course, the learning should go both ways. In terms of co-benefits and solutions, the type of work we do, for example, we're launching now a Solar for Health initiative, working with countries to to ensure that their health centers have energy to basically put solar panels on all health centers. This has multiple co-benefits, and I think we're going to try that out in Sudan and Zambia soon. The idea is that we're addressing renewable energy goals, we're reducing the kind of problems that a health clinic faces when they have intermittent energy supply in terms of vaccinations and what they can keep cold. Have some other dimensions in terms of gender. We do a lot of our solar work. We train local sort of women to be the ones installing and repairing. So we think through how can we kind of have multiple check marks across the goals. And in terms of the paradigm shift, I mean, my colleagues have said the SDGs, we are excited about it. It's not going to happen without the advocacy and civil society also embracing them. And for my organization, we're very excited. We have Akim Steiner, who's going to be our new head, who headed UNEP. So I think the environmental planetary health kind of lens is very, very promising to be kind of a way forward. Thanks.
Thank you, Natalia, and panelists for your insights and getting the conversation going with these partners at various scales. So as you've heard throughout the morning and hear from the panel, strong partnerships and understanding among key stakeholders will be necessary to identify and implement science-based sustainable solutions to these really complex planetary health challenges. So I hope you walk away from this session considering these institutions represented here not just as beneficiaries and users of scientific knowledge and understanding, but also as your working partners to help identify scientific and really important scientific questions, science needs, and science decision pathways for impact. So thank you for your attention. Thank you very much to the panelists for your insights and sharing the work of your important institutions. And please, let's adjourn to lunch and continue the conversation there. Thank you, everyone.